Does the addition of intratracheal budesonide to surfactant reduce bronchopulmonary dysplasia in preterm infants? Are important cell and gene therapies accessible to those who need them? How should clinicians interpret research on moderate alcohol consumption and health? This and much more on today's JAMA Editor's Summary. Hello and welcome to our listeners around the world. Today is Friday, October 3rd, 2025. I'm JAMA Deputy Editor Dr. Linda Brubaker, sitting in for Dr. Kirsten Bibbins-Domingo, the Editor-in-Chief of JAMA and the JAMA Network. I'm joined today by JAMA Deputy Editor Dr. Chris Muth. Hello, Chris. Let's get started.
Hi, Linda. JAMA published a double-masked, large multicenter trial about bronchopulmonary dysplasia, or BPD, in premature infants. Dr. M. Balavanan and colleagues assessed whether the addition of intratracheal administration of budesonide to surfactant reduces BPD or death. Over 600 newborns less than 29 weeks gestational age were randomized to receive 1 to 2 doses of budesonide with surfactant or surfactant alone via endotracheal tube within 50 hours of birth. The primary outcome was BPD or death by 36 weeks post-menstrual age. The authors concluded that budesonide plus surfactant does not reduce BPD or death at 36 weeks compared with surfactant alone.
JAMA Deputy Editor and Pediatrician Dr. Tracy Liu handled this trial, the BIB trial, for publication. She shares that she's, quote, excited to have the BIB trial in JAMA because it's from the U.S. NICHD Neonatal Research Network and is one of the world's 2 definitive trials on intratracheal budesonide for preterm infants. JAMA published the other one, the PLUS trial from Australia and other countries last year. Dr. Liu also notes that, quote, the BIB trial has the distinction that all infants who received budesonide got it with the first dose of surfactant, which is how it would be used in actual practice. Still, the 2 studies, PLUS and BIB, came to similar conclusions that the treatment didn't reduce the risk of bronchopulmonary dysplasia or death in these infants, unquote.
Okay, Linda, let's get into this week's research letters. Dr. Chambers and colleagues conducted a cross-sectional study to examine commercial health plan coverage for cell and gene therapies. They identified coverage policies using the Tufts Medical Center Specialty Drug Evidence and Coverage Database. These authors concluded that commercial health plans commonly impose coverage requirements for FDA-approved therapies beyond FDA-approved product labeling. Professor Majral and colleagues contributed a related viewpoint on the new cell and gene therapy access model created by the Centers for Medicare and Medicaid Services. They explain how this new initiative will improve access to these important therapies for Medicaid beneficiaries.
In another research letter, Ashwin Shetty and colleagues describe clinical characteristics of Medicaid beneficiaries at risk of disenrollment due to H.R. 1's emerging work requirements. Using pooled data from the National Health and Nutrition Examination Survey, or NHANES, they report that roughly 5 million adults, many with chronic conditions, are at risk of Medicaid disenrollment. And there's also a single-center study investigating RSV vaccine response in recipients of allogeneic hematopoietic cell transplants. 94 patients received the vaccination following transplant, and vaccine-induced immune responses were measured. The authors conclude that recipients demonstrated reduced humoral and cellular response to the vaccine compared with non-immunocompromised adults.
There are some more JAMA viewpoints from this week. The H-index has been used in academic medicine to quantify an individual's scholarly impact. In their viewpoint, Drs. Mannix and Bell propose a new metric, the Service, or S-index, that may better recognize the full spectrum of academic contributions. Drs. Navin and Ross discuss recent vaccine policy changes that affect public health and ways to build trust to ensure healthier communities. And Dr. Zucker reiterates the importance of routine immunizations in preventing infections like measles.
In a JAMA Perspective article, Dr. Callange and colleagues consider the impact of moderate alcohol consumption and health. We know that discussions of the impact of alcohol on health is an ongoing conversation in research and the media. These authors focus on how to interpret the recent National Academies of Science, Engineering, and Medicine report on alcohol and health. Chris, the incidence of early-onset gastrointestinal cancers diagnosed in individuals under 50 years old is rising. For more information on early-onset GI cancer, including risk factors and symptoms, check out this week's patient page.
And asthma is the most common chronic airway disease worldwide. Dr. Cardette and colleagues contribute a JAMA Insights article that focuses on evaluation and management of severe refractory asthma. Let's hear a bit more from Dr. Cardette on this week's JAMA Clinical Reviews podcast.
So, severe refractory asthma, and this is definitions put together by task forces from professional societies and recapitulated in the Global Initiative for Asthma, is asthma that remains uncontrolled despite treatment with high-dose inhaled corticosteroids as controller therapy, plus at least a second controller, such as a long-acting beta agonist, and that those symptoms are not due to, for example, incorrect inhaler technique use or non-adherence to controller therapy, or because of a comorbid condition of asthma or an asthma mimicker. And there are several contributory comorbid conditions in asthma that can impact disease control. So after conditions such as a gastroesophageal reflux disease, nasal polyps, chronic rhinosinusitis, vocal cord dysfunction, and others, after those have been attended to and controlled, if asthma symptoms remain, then we call that severe refractory asthma.
And this week we had a special medical news podcast about a 2024 JAMA paper that's been receiving a tremendous amount of attention in recent days concerning acetaminophen use during pregnancy and children's risk of autism and other intellectual disabilities. I spoke with senior author Dr. Brian Lee.
These mothers who use acetaminophen are different in many ways from mothers who don't use acetaminophen. As you mentioned, there are indications for use: headaches, infections, fevers, things that have been plausibly associated with autism and other conditions in the past. And these things are what we call confounders, a third factor that might explain an association. One of the examples I use in the classroom to explain confounding is eating ice cream and risk of drowning. And the idea here is that ice cream is statistically associated with risk of drowning. But this is not a causal association. It is actually hot weather that increases ice cream consumption, as well as increases likelihood of swimming, which would increase likelihood of drowning.
And a quick reminder that the latest articles in clinical medicine, biomedical research, public health, and health policy, written and researched by our outstanding JAMA Medical News team, are at jamamedicalnews.com. Or you can click on the link in the episode's show notes.
Thanks, Chris. And thank you for tuning in to hear what's new at JAMA this week. These highlights were brought to you by Dr. Chris Muth and me, Dr. Linda Brubaker. This episode was produced by Shelley Steffens and Dr. Krista Roberts at the JAMA Network. A link to this JAMA content can be found in the episode show notes. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com. And thanks for listening.
This content is protected by copyright by the American Medical Association with all rights reserved, including those for text and data mining, AI training, and similar technologies.